everybody and welcome back to my channel. I am here today with a very requested video. A lot of you guys wanted to know what is in my clinical bag, but first make sure you click that subscribe button down below and also follow me on Instagram because I'm very active on Instagram. My life is really crazy, so if you want to know what I'm up to, follow me on Instagram. If you don't know, I am a nursing student. I am going to be graduating with my BSN this December, and you guys, it's seriously like this degree has been a very long time in the making. I have two small children and one of them I birthed in this process, so if I can do it, you can do it. Everything in this video I will link down below. I pretty much got all this stuff on Amazon and it is super duper helpful. But if you have something in your clinical bag that I do not have in mine and it can be super helpful, please let me know because I am all about making clinicals and my future nursing career as easy and efficient and helpful as possible. Does that make sense? Sorry if you can hear my kids screaming in the background. I'm a mom, so that's just my life. But anyways, let's just get into this what's in my clinical bag. This is my legit clinical bag that I literally used this weekend. It still has my old coffee mug in it, which you're about to see. So it's really heavy. There's a lot of stuff in it. 12 hours is a long time, you know what I'm saying? Like, you need to have your whole life, you know? First up is my coffee mug that still has coffee in it from Saturday because, you know. This is Lasting Coffee brand. I don't know. I think my mother-in-law might have gotten it for me. I need coffee. I literally have coffee at my lunch break every single day because, like I said, 12 hours is a long time, okay? Okay, no surprise there. Next up is a cootie covered water bottle. Make sure you have a water bottle with a lid on it. You don't want exposedness. Getting into the exciting stuff. What is this? Oh, this is just some information that my preceptor got for me on ventilation versus oxygenation because I had a ventilated patient. Then I have all of my patients' medications, which is a lot because I am in the PICU. And then she also kind of just got me some stuff about heart failure and transplants and all kinds of crazy stuff like that. So that was really cool that my preceptor did that. So that's in there too. Let's see, I always like to carry paper on me. Either it'll be something kind of like this for shift report. I find this to be the most convenient because one patient will take up literally, not exaggerating, this entire piece of paper for handoff. Like, these kids are sick. I try to have as much paper as possible. I don't know why, that's just the preparedness in me. So these are just little notebooks that I like to keep in my scrub pockets. I have used these for numerous clinicals. If I can find these or something similar, like I said, I'll link them down below. But these little notebooks are so helpful, especially if you have numerous patients and you did something and you need to write it down. Like, you know, I'm in peds, so like if I weigh a diaper, I need to quick write that down, or, you know, there's just vitals, stuff you don't want to forget. It's helpful. More post-it notes. Like I said, I have a paper problem, okay? Another notebook. $5. You never know when you're gonna forget your lunch like I did on this day. Luckily, it was in my car and my preceptor let me go grab it quick. Hotel room key because I sometimes stay in a hotel because my clinical is really far away. More paper, pen. Let me know, can you have blue and black or is it just black pen? Nurses out there, let me know. I know that it's definitely black, but I'm curious about blue. So I always have tons of black pens on me just because nurses have to legally write. I think it's just in black, but maybe blue too. All right, now we're getting into the exciting stuff. The stuff that's actually helpful. Deodorant. I always forget to put my deodorant on, so I always have like a pretty much completely gone deodorant in my clinical bag, just, you know, just in case. Okay, now let's get into the actual stuff that is helpful. This I highly recommend. This is probably my absolute favorite resource that I do have. And this is just because it has procedures, assessments, lifespan, emergency, like pretty much a very vague covering of absolutely everything. I really like this because there have been, especially in my first clinical, I was like petrified I was gonna have to start an IV, and it just made me nervous for some reason, so I could literally just pull on up to, let's see, which one is it? I used to know, I think it's in this Meds IV, but I could literally pull it up and it'll literally tell you how to insert an IV. And even though I knew, just with like nerves, I always liked to kind of like go over it and like just the angles of administration and all that jazz. So I really liked having this. It was super helpful for me. I don't use it so much anymore, but it has even like assessment pieces and everything. This one will cover pretty much any specialty specialty, so this is why I recommend this one the most. This one I don't actually carry with me. This is the med-surg one, and it just kind of looks like this. This is very med-surg focused. I had three med-surg clinicals, so this is what I use mostly for my med-surg, and it's just kind of nice because it kind of goes into every single like body system, and it's super duper helpful. Like I said, I would carry these around like I was on a neuro floor last semester, so it was easy to just look in here and how you assess neuro status and things like that. So this is super helpful. I'm telling you, one of my professors even still has her version of this RN notes, and she's been graduated for probably 10 years now, if that means anything. Next up, this is a pocket drug book. It's nice to carry with you at clinical, but so many, if you have electronic charting, a lot of them in the MAR will literally have like LexiComp or something like that where you can just look up the drugs. I will find the book that I actually want to get and I'll link it down below. I will link this down below in case you want to carry something like this on the unit or something, but there is a bigger book that I am probably going to get still, and I'll link that one down below too. But drug book is really helpful if you have to do care plans like I do. They're horrible, but I do them. This is really, really helpful. This is the Medical Surgical Nursing Clinical Companion. This is the med-surg book that I have for my class. We call it Lewis. That's just, I feel like all of our books we just call by the first author. So this goes with my Lewis book, and this literally has every, like not every single, but most common disease processes, conditions, whatever, and then it'll literally have like, let me open it up real quick here. All right, so like acute kidney injury, it'll have description, pathophys, clinical manifestations. I literally just went over kidney failure, which is really funny. Diagnostic studies, interprofessional care, nutritional therapy, nursing management, everything that you could possibly need to know, and then patient and caregiver teaching. Anything you would need to know about a condition or disease process is in here. It's such a great study tool, but also helpful if you have a patient with a condition and you've never heard of it before. Like I had a patient with myasthenia gravis. I've never heard of that before. So what did I do? I opened up my book and I looked at myasthenia gravis, and what do you know? I found out all the information. It's helpful, period. Stethoscope. This is a Littmann stethoscope. I think it's just like, it's a 3M Littmann Classic 3. I always have this linked in all of my videos, so if you know you're not in the market and you are eventually, this is the one I have. You can customize them. I pretty much like all black because that's how I do, so that's the stethoscope that I have. All right, next up, I have just a battery charger to charge my phone. I don't know why I have it, and I'm glad I brought it because I forgot my actual charger, but it's just in there. $1. Last but certainly not least, I have 6 more pens. And a pen light, which is super helpful because it has your little measurements on here, and obviously it's a pen light so you can check pupils, which is very important for your neuro peeps. So that is literally everything in my bag, and then I just have this. If you know of like a really cute clinical bag other than like 31, just because like I don't want to pay a bunch of money, let me know. But I hope you guys enjoyed this video. That's what's in my clinical bag. I hope that filled your curiosity, and like I said, let me know if you have something really helpful that you have that I don't have. Don't forget to follow me on Instagram and subscribe, and I'll see you guys in my next video. Bye guys!